if you have MS, I'd get checked out. Just go get checked out. You know what I mean? Like it's not going to hurt anything.
Right.
And if it doesn't help your MS, it's probably going to help something else, like upper cervical care. Like we need to take care of our spine. You know, it's crazy that we continue to see patients year after year, and they still don't know how important their spine is to them because they've never been told.
Yep.
Okay, welcome back everyone to the Upper Cervical Chiropractic Research Show. This is episode 32. On behalf of the Council on Upper Cervical Care, I am Dr. Kevin Leach, and here with me once again, Dr. Tyler Evans. How are you, sir?
Good to see you. Doing well.
Sounds good. So today we are going over not a specific paper, but we're going over 3 different papers on CCSVI and multiple sclerosis. So we're going to go over those 3. I'll post all the links in the description below for everybody to go and, look at the copies themselves. But we're just going to go, do a little overview, talk about, when they were done and kind of what they did and the significance of each one. So Dr. Evans, you want to take care of that? Just kind of, talk about each one just real quick in snapshots, and then maybe we can just kind of go from there and talk about what's good.
Yeah. So, I think it's kind of a fun, fascinating fact that Dr. Kevin Leach was there in Italy with many of these doctors before these papers were written. Yeah. And, it's a very cool, interesting relationship between the upper cervical community there in Italy and the medical doctors that focus on this vascular issue and this cerebrospinal venous cerebrospinal venous insufficiency, which means a lot of things, but particularly what we're focused on in these papers is showing a relationship between misalignment of the upper neck and compression of a jugular vein, which it lays right in front of the C1 TPs. And what we'll find in chiropractic is one TP will, generally it's one side will rotate forward. We call that, in the papers, they call that anterior intrusion. And we then see that the TP is intruding into the jugular vein and collapsing it down. And that's not good, because what that does is that backs fluid, venous fluid, up into the head. The head has to drain that fluid out. If it doesn't, what happens is cerebrospinal fluid actually backs up in the brain, because the downstream effect is that cerebrospinal fluid is pumped out into the venous drainage. The venous drainage then takes it, circulates it back to the heart and cleans the blood and then oxygenates it. And yeah.
So and again, if there are non-providers watching this, the veins, take blood back to the heart, arteries go away from the heart, right? So it's, complicated with the lungs and whatnot. But when we say venous or venous drainage, we're talking about the blood going out of the head.
Yes.
Right.
Yeah. And the jugular veins being the 2 largest drains out of the skull, right. And the carotid arteries are the 2 arteries that bring blood up into the skull. And then as well, around the spine, we actually have a venous drainage that wraps around the spine. Those are called the accessory veins. And then as well in the spine, we have the vertebral arteries that go through the vertebral vertebra, the vertebra, right? Got it. So with all that said, what's really cool about this is in 2013, they published a paper, Mandolesi, is that how you say it, Dr.
Mandolesi?
Mandolesi, I butchered it, I'm sorry. And then you actually knew Dr.
Marceca, yeah.
Marceca,
yeah.
And Conicello.
Yeah, Stephen Conicello is a knee chest doc on the East Coast.
Yep. Yeah. So that's super cool. It's neat that we have these relationships with these medical doctors over there. They published this first paper in Matt McCoy's journal what is it? The Journal of Upper Cervical Chiropractic Research in September of 2013. Basically, they studied 7 patients, and they just were feeling out the feeling out the world of publishing here, and they came up with 4 patients with MS and CCSVI. 3 were women and 1 was a man. They evaluated according to revised McDonald criteria. These 4 patients were compared to a control group, basically showing that they had these problems, 1 being misalignment, and 2 being the CCSVI, and 3 being the MS. So that was the trick, was they were just trying to show, okay, there is a possible connection here. That's all they're showing. They did show correction of the misalignment, which was great. They studied that, and they did show, we found not only the endovenous, but also external venous, so being inside the vein problem. So that's the CCSVI part, and then external being the compression blocks that we get with the intrusion of the C1TP. And then just saying that they did see a change in the misalignment. So that was the first paper. That kind of set it up so then that they could take that and then publish more, unless you have something that you wanted to share about that paper, Dr. Leach.
Well, I was just thinking about just for people to understand the mechanisms and of what's happening, but I was thinking maybe that can wait as far as what it means to have the insufficiency inside the vein or outside from the transverse process. But I think we can get into that. Yeah, we can get into that a little bit later.
Well, in that paper, they actually, I'll just mention this too. In that paper, so the origins of the CCSVI group are actually established in this paper. It talks about, I think it's in like the 5th paragraph. They talk about the big idea of the CCSVI group, cerebral-spinal venous insufficiency. The big idea is that this hypothesis that was created by Paolo Zamboni. In 2006, Zamboni wrote a paper in the Journal of the Royal Society of Medicine. The big idea, iron-dependent inflammation in venous disease and proposed parallels in MS. This paper outlines the mechanism of pathology in CCSVI and MS. This paper also suggests there is a connection due to similarities in tissue response. To summarize the findings of the paper, the correlation begins with these conditions of CCSVI. So Dr. Zamboni, he actually started out doing stenting. So they were opening up the jugular veins and seeing changes because, okay, you've got a compression of the jugular vein so that fluid's backing up. You then get fluid retaining or stasis on the brain, that then we get these lesions. Before the CCSVI group, we didn't really recognize that there could possibly be another etiology or another mechanism to the problem of MS, where before that we were thinking, oh, it's all autoimmune disease, autoimmune. In chiropractic, we've been talking about MS being a structural issue for a long time, or at least partly, and getting the upper neck corrected makes a change, and then patients see results. Well, this is a new way that we can think about this, is that Dr. Zamboni, he was opening up the jugular veins, which are the 2 biggest veins, with stents, and seeing that that fluid was draining. Therefore, the metabolic waste was leaving the brain and the nervous system and the central nervous system. So the spinal cord was healthier and the nervous system healed. A lot of times MS patients have things like numbness and tingling, vision issues, hearing, all kinds of neurological disorder patterns. And the stenting would help a lot with that. I think that it ended up having some negative results down the road. So they actually changed course there on the stenting. And this ended up being a nice kind of secondary, like, oh, hey, we don't have to put a stent in the jugular vein. We can just do a correction with C1 to take that pressure off of the jugular vein. Great, let's do that. So I think that's a good foundation.
Yeah, that's a good background for sure. So this first one is pretty much, there were 4 patients. they looked at the anterior intrusion of 4 MS patients, compared it to a control group, and said there's a significant finding here. They said, yes, look, these MS patients have this, study group doesn't. There's only 4 patients, not much, it's a pilot study. So they said, okay, what's the next step, right? So next step is the next paper here. So this next one, this next paper is preliminary results after upper cervical chiropractic care in patients with chronic cerebrospinal venous insufficiency and multiple sclerosis. So, so this one, they actually measured a little bit more of the outcomes, right? So, Doc, you wanna review this one real quick?
Yeah. So in this study, we had 77 patients before and after upper cervical chiropractic care, and we analyzed A, the change of the X-ray parameters, so the misalignment of C1, to B, the clinical results using a new set of questions, a protocol of C1, C2 upper cervical chiropractic treatment specific for these patients, last 4 months. And from a hemodynamic point of view, we divided the patients in 3 types. Type 1 was purely vascular with intravenous alterations. So that would be not a mechanical compression of C1 or of the jugular vein with C1. Type 2 was a mechanical with of external venous compression, and type 3 was mixed, so both, right? So they found an improvement in all kinds of the misalignments of the treatment with respect to the pre-treatment X-ray evaluation, and found a statistical difference, which is very good. That's what we want to see. So that's what the first paper did not do, right? So that's what we're seeing here is a statistical difference. Right. The difference between the clinical symptoms before and after the specific treatment of C1, C2 are statistically significant with P less than 0.001, which is quite good, according to the chi-square test revised by Yates. So preliminary X-ray and clinical improvements of the upper cervical chiropractic corrections with patients with CCSVI and MS encourage us to continue with more studies and continue, finding out what's going on here. Yeah.
Cool. Yeah. So they got improvements after the care with X-ray, but also improvements in outcomes as far as symptomatic improvement. So just real quick, they did 6 different outcomes. They did visual, acoustic, urinary, rectal, cognitive, perceptive, and motor, and all of them had a p-score of less than 0.001, which is statistically significant. Very good. So the visual improvements had 37.5% after upper cervical chiropractic care. The acoustic had 49.3% after upper cervical chiropractic care. Urinary rectal 43.5%, motor 35.3%, perceptive 78%, and cognitive 59.5%, which is all, obviously significant, especially when it comes to that person's, quality of life and improvement. So the study is very much suggesting that mechanical misalignment of the anterior intrusion could potentially have something to do with, with the MS and the CCSVI. But it could also actually, just thinking about it, it could also have to do with just improving cerebrospinal fluid flow, all kinds of different stuff, right? But important to see that at least they're coming up with their own hypothesis on why there are improvements, and why there are improvements that, upper cervical chiropractic has seen for quite a long time with MS patients. Right. I'll just throw this out there just because you mentioned, and, me being in Italy and obviously these tests and, coming out of Italy. I remember a patient that I had over there who had MS. He was probably, I think he was 35, typical eye symptoms, lesions on the MRI, et cetera. He was under care for a year. After a year, he was literally symptom free, had an MRI and the lesions were gone. And so I never actually, verified that MRI pre and post, but that's what he reported. And he was symptom free and healthy and feeling fantastic. So that was a really cool
Yeah, and one of my first patients too. It was actually, I was practicing under Dr. Darren White in Kirkland and in Kirkland, Washington. And one of our patients, I actually did my diplomate program research study on that patient. Was had MS had focal lesions on the central nervous system. Many MRI studies over years, right? No changes in them. Corrected over the course of 6 months to a year. Symptoms reduced dramatically, lesions reduced dramatically. Maybe.
Yeah. Totally.
Maybe it's connected.
Yeah.
But yeah, and it's the same thing. It's right what you said. It's like, we don't have big studies, we don't have all this money that we can throw at this, but this is what we see. We have patients that come back and they say, hey, I got it. I get an MRI annually. Usually these MS patients, if they're really symptomatic, they'll get an annual MRI to check on those lesions with their neurologist, and they'll see reductions in those lesions, and that's big.
Yeah, totally.
And symptoms, right?
Yeah. Anything you want to go over this, the second paper here, the preliminary results paper, before we move on to the next one?
No, I think that's good. I think we covered it well.
Cool. All right. So this last one here is, so they just did a little bit more. So the first one was 4 patients. The second one was 77 patients. This one is 386 patients compared to a control group of 156 patients. So Doc, go ahead and talk about the results that they saw with this one.
Yeah, so in this one, they actually broke down the prevalence of the anterior intrusion and measured the actual intrusion itself. So the complete compression of the internal jugular veins in front position shows a prevalence of 48%, and it is equally distributed in the various segments of these veins in patients with CCSVI and MS. The aim of this search is to identify C1, C2 misalignments in patients with CCSVI and MS. So we investigated 386 patients, 156 were without MS. The assessment of anterior intrusion shows the following average values in the group with CCSVI and MS: 4.29 plus or minus 1.48 millimeters, while in the control group was 3.78. So we're talking about almost half a millimeter there, which is quite right at half a millimeter, which is quite a bit, right? When we're talking about intrusion into a jugular vein, right? That's a big deal.
Yep.
And then let's see, in the control group was 1.9 or 2.3 to 1.97. So quite a big difference there. 2.3 to 1.97. So we found also that a longer duration of the disease corresponds to a higher severity of the pathological condition. So the conclusion: the data analysis of C1, C2 misalignment shows statistical significance of severe anterior intrusion and right laterality, meaning the vertebra has actually moved to the right. Misalignment in people with CCSVI and MS. And actually, if I recall, that patient that I took care of way back, she was a ASR, so a anterior superior and right intrusion.
Which is a whole, that's interesting in and of itself, why it would be more right laterality than left laterality. I know you've talked a little bit more about maybe it has to do with like right-handedness.
Yeah.
Or something along the line. There's no research. That was just a hypothesis.
Just hypothesis.
We talked about. But very, very interesting.
Yeah. And let's see. Considering the novelty of this work, the total absence of scientific similar works able to confirm this data, it is necessary to continue these studies, and we need further research. But yeah, so basically they correlated a large anterior compression with CCSVI and MS. Not to say that patients don't have misalignment, so if they don't have misalignment, that they may not have MS or CCSVI. It's just in these patients, we saw that there was a large intrusion when they had CCSVI and MS, and not in the patients that didn't. if that makes sense. So we
Yeah.
can't draw any conclusions outside of what we saw in the paper, but
Of course.
right.
But it is interesting, you know, it seems to suggest that there could be several reasons, several causes, right, to what's going on, which makes it elusive and interesting and curious, right? I mean, you know, all patients are different, and the duration of you know, the MS symptoms could have a have a factor as well. I mean, I talked about the 35-year-old, but I also had and this is in Italy as well. I also had I mean, he was probably in his 60s or 70s in a wheelchair, had MS for 30 years, right?
Oh,
He came under care, and guess how much improvement there was?
zero.
Nothing, literally nothing, right? So it's like, you know, it's been there. You know, the problem was there for probably years prior. Symptoms started 30 years ago. He was wheelchair bound. It's like, you know, it's like uncooking a hard-boiled egg. You know what I mean? So it's like, so the idea here is with anybody with MS, you know, symptoms, like this could be a factor, you know, whether the upper cervical misalignment is the CCSVI, whether it's the cerebral spinal fluid, whether it's both, whether it's, you know what I mean? Like 5 other things. It's like the spine, there's evidence that, you know, the spine is related to MS, period. Right. So it's like, you know, this doesn't have a multi-million-dollar NIH study behind it, but it's like, like if, you know, this is, and it's obviously for anybody with MS, and, you know, they have the means to do so, and they can find an upper cervical chiropractor to get some care. I mean, even if you improve a little bit of quality of life, obviously that's going to be well worth their time. So, you know, I think these papers are just, you know, added to the body of research that's supporting, you know, the MS being, you know, related to the spine and being helped by chiropractic and, you know, upper cervical chiropractic. So I think this is valuable. And so I hope it gets out to more people that have MS and that are looking for answers, especially for natural solutions and trying to figure out what the cause is. And, you know, maybe they still have to take meds and you know, and they still choose to take meds, but you know, if we can, the earlier we can get to it, you know, obviously the better off people are going to be.
And one more thing too. So we've done a paper previously, and I love seeing. I love seeing the comments on the old videos we've done. It's really interesting because there's a lot of them that are super positive, and there's some of them that are really negative, and that's just YouTube, and that's just YouTube, social media. You know, but it's really cool because you know, we do these videos, and you outlined. We talked about the paper by Dimitri and Rosa that was the possible etiology of MS through trauma, right, or something like that. The cervical trauma, something or other. But the point is that we talked about how, here, look, they show Doppler changes in cerebrospinal fluid flow before and after corrections, and therefore they may be and they showed the statistics of the patients that had symptoms and saw changes. They all had big traumas to their neck, car accidents, rollover car accidents, falls off a ladder, fell out of a building, you know, hit their head really hard, that kind of stuff. And what's funny is back probably, you know, 10 years ago, it wasn't really talked about much at all that trauma could bring on MS, because it's all autoimmune. It was all autoimmune disease. We don't know what causes it. Here's some medications, just take these medications. But now we're seeing that, you know, these are 2 great studies out of the Italian Chiropractic Journal, and it's in PubMed. And then the other study from Dr. Dimitri, and the guy that invented MRI, like that's a huge study with Doppler there, and showing some great changes. So, you know, it's coming around, and I think it's important that people know that trauma would be a indicator that it's time to get your neck checked, especially if you have developed symptoms like numbness or tingling, vision changes, hearing loss, things like that, right?
I agree. I mean, you know, I probably shouldn't say this, but it's like, you know, you know, we always have to say that with the research, oh, there's no conclusive findings. We need to do more research. And, oh, if you've had an accident, maybe get checked out. But it's like, for me, it's like, we don't remember all of our accidents. We don't remember all of our slips and falls. We don't remember the falls off the jungle gym. We don't remember all these things. If you have MS, I'd get checked out. Just go get checked out. You know what I mean? Like it's not going to hurt anything.
Right.
And if it doesn't help your MS, it's probably going to help something else, like upper cervical care. Like we need to take care of our spine. You know, it's crazy that we continue to see patients year after year, and they still don't know how important their spine is to them because they've never been told.
Yep.
You know, and it's like as each year goes past, I just get, I don't know if I get more frustrated, but it's just more and more sad that people just, you know, they think every patient that comes in, what's upper, you know, and you're just like, you're just devastated for these people because they just don't know a kind of care, a kind of health care that could be a huge part of their health and could get help, and they just have never been told. So
yeah, I hear that. And we are here to get the word out. That's why we're doing these videos. And I am seeing more and more kids coming in. I'm seeing more and more parents bring their kids in. And that is huge. That puts a smile on my face and lets me know that, you know, people and younger people are coming in. You know, it's more and more the younger generations are like, yo, something's wrong with me. Like I just had a woman today. She's 31 years old. She's like, I've been to everybody. I don't know what's going on, but I need to get my spine checked. She's 31. You know, it's not like she's 20 or 15, but you know, that's way better than 60, which is what I do see a lot, you know. And then it's like you said, you can't unboil the hard-boiled egg, right? So I see it more and more, and that's the trick is, you know, so parents are out there, if kids are struggling with symptoms, with problems, get them checked. And that is a great way to help the world, make the world a better place for sure.
Yep. Yeah. I've been looking for the other videos that we did so I could tell anybody watching if they were interested to go back. So we started with episode 7 with Genesis of Multiple Sclerosis, CSF hydrodynamics. And then we did 8 with CSF cerebrospinal hydrodynamics. And so 7 and 8 have a little bit more on the MS and more of the cerebral spinal fluid stuff. So if people want to check that out, go to the channel, go to the Progressive Chiropractic playlist, upper cervical chiropractic research playlist, and then it will be, you know, near the beginning of the playlist for that. And I might just throw it in the description below if I remember to do so. So.
Yep.
Cool. Anything else any conclusions or any kind of just any thoughts to wrap this up?
Yeah, I mean, I think that these 3 papers are a testament to the work that you did and the work that all those doctors did over there in Italy. I know that, you know, it kind of fizzled out there over in Italy. I think there's still some docs there, but, you know, for what it is, like, these are great papers, and they'll continue to live on, and through this video, more people will get recognition. So, I mean, kudos to you, Dr. Leach. You graduated and went right over there to Italy, had no idea, you know, what you're getting yourself into, and you practiced over there for 3.5 years and changed a bunch of lives. And, you know, quite frankly, like, you're probably part of the reason this got made, because you were there supporting the team and making this thing go. So
yeah, it was interesting. It was definitely interesting. I wasn't involved in too much of like the writing of the research or anything like that. But you know, I remember meeting Marceca several times. And then I'm looking at a picture of Mandolesi, and I'm pretty sure I met him as well. So, you know, as I was over there, I probably, you know, met them, and you know, I think they did this, you know, by the time I was gone. But yeah, it was an interesting experience living in Italy for 3.5 years. Different culture for sure. Good and bad, you know, good and bad.
Yeah, a little bit.
It's interesting. You get to see you see the pros and cons of both countries. You know, you're like, oh wow, this is really cool in Italy. I wish they had this in America. And then you're like, this is horrible in Italy. I'm so thankful in America, it's not that, you know what I mean? Like it gives you perspective. I mean, it's like the whole world, becoming a worldly thing. So anyway,
absolutely.
Cool.
Yeah,
Awesome.
very cool.
Yeah, well, to close it out, on behalf of the Council on Upper Cervical, again, I'm Dr. Kevin Leach, Dr. Tyler Evans. Thank you as always, and we will see you next time. Awesome. See ya. Okay, that's it for this episode. So what did you learn that fascinated you or surprised you about the research today? Join or start the conversation in the comments below. Hey, thanks so much for watching. To watch more of our research shows, click or tap the screen right there. To subscribe to the channel, click or tap the screen right there. Until next time, I'm Dr. Kevin Leach with the Upper Cervical Chiropractic Research Show, bringing awareness to conservative primary spine care, upper cervical chiropractic care, and traditional chiropractic. Until next time, take care and take care of your spine. It's the only one you'll ever have.